Good morning, everybody. Fantastic keynote this morning, and I kept thinking as somehow Gloria was able to go up there without notes and talk for an hour and a half, and she was so funny, and I was just thinking, I am not funny at all, and I'm going to talk about accreditation after an amazing program, but here we go anyway. So just a little bit about Community Reach Center. Some people who are in the room right now are actually in that picture down there. That was our all-staff meeting that we just had, and took a drone photo outside afterwards. Also, above that is our new subacute residential facility stages that just got completed, 16-bed facility. Just a little bit more about Community Reach. We actually, over the last year, increased the folks that we serve from about 15,000 upwards of 20,000, and have 600, very close to 600 staff. So this definitely, our accreditation process was definitely a journey. So why CARF? Or why accreditation in general? This definitely isn't a presentation just for CARF itself, but also just accreditation in general. Plain and simple, we really wanted to separate ourselves from our competition and decided that we wanted to really make systemic improvements in the way that we do things that was not externally imposed by changes in Medicare, changes at the state, or changes in leadership, frankly, that we wanted to create a model and a way of doing business that would stand the test of time and that really could demonstrate to not only the people that we serve, but the people in our community and our other stakeholders that we really had a commitment to excellence. And so a few years ago in our strategic planning, we decided to have two goals in mind at our center. And those two goals were to be an ultimate wellness destination for our consumers and an ultimate employment destination for our staff. And that word destination is really important. Destination really implying that this is where people want to call home. And being an ultimate employment destination is really connected to being an ultimate employment destination is really connected to being a wellness destination because, as all of you know, when staff are frequently turning over at the center, that has disastrous consequences for those that we serve, right? Nobody wants to continue to engage in services when they have 4 doctors during a year or 3 therapists and have to tell their story over and over. And so if we create an organization where people want to make that their home and they want to make that their career, which is becoming pretty rare these days that people would make an organization their career, then we felt like we were achieving our goals. And so CARF is an international accrediting body. They don't just accredit mental health centers, they do skilled nursing facilities, lots of other things. For those of you that are from other states, I came from Wyoming and was actually just talking to one of my former colleagues in Wyoming, and CARF is just sort of a standard. It's just how things are done. And so we decided to go with this organization, but there are definitely others to choose from. So as I had said, 600 staff, lots and lots, about 60 different programs that we have. Making changes like this is a bit like turning a cruise ship. And so what we decided to do was really undertake 2 major initiatives at the same time that worked us toward becoming that destination organization. We decided to undertake an evidence-based practice called feedback-informed treatment that many of you have heard of, and extend that across our entire organization. And so rather than it being simply with outpatient or simply with therapists, that we made a commitment that feedback-informed treatment was going to be how we did business and that it was going to be our standard of care. And I'll speak about that a little bit more. We also decided to undertake a cultural change. And that cultural change for us was called Trust Edge. And again, I'll speak about that in a minute, but really bringing out a training to every single one of our staff to let them know that we care about them professionally and personally, and that this is how we as employees are going to do business. So some questions to ask yourself if you are ready to undertake a change like this or to pursue something like accreditation. Do your staff believe that the leadership and management team have the best interest of those that you serve and your staff at heart? Do all of your staff understand the mission and vision of your organization? And do they believe that the leadership team communicates that often? Do your staff understand what the most important priorities at your organization are at any given time? And priorities being things that shift. And if you're going to undertake a cultural shift or an accreditation process, do you know who your champions would be in that cause? So we set sail. And just showing this slide here, CARF has a CQI process that they call Aspire, and really everything that we did and every standard out of the 1,500 standards that we worked on meeting, we worked through this particular Aspire process. Really important in here is the person served and other stakeholders and obtaining their input. As a result of pursuing accreditation, we formed a consumer advisory panel. Over the last few years, that went from a very small group of people to a really large and dynamic group. Whenever at the leadership team we are stuck in something, we often go to our consumer advisory panel and they have fantastic ideas. So a prep team was put together, and that's why I speak about champions. Really important to have a small core group of people that are not necessarily, in the leadership or C-suite, that these are the folks that are responsible for getting things done. And what we did do at the leadership table, though, was say, this is the champion team that's going to undertake this change. You will listen to them, right? That they had very high direction and permission to, even if it didn't feel right, some of the changes that were going on, or maybe this isn't the way that we've always done things, that those champions were really responsible for taking us through to that place. When I moved into my predecessor's office, I found CARF materials from almost 10 years ago in my office in a desk. And it had been something that we had been talking about and talking about and talking about. And really the most important thing that we did, I think, was we sent the check to CARF for the survey. And we set the date. I think that if you are going to pursue something like this, you are never going to be fully ready. You'll never be in a place where you can say, definitely 6 months from now, we are going to be hitting all of those 1,500 standards. It was really important to send the check, set the date, and just be ready to go. We also had, about 6 months prior to the actual survey, we had what we called a CARF boot camp and invited our entire management team. It was a half a day where we just got people energized, got people excited about what we were doing, many of the main things that we were working on, how they would be able to bring that down to their staff, to notify our consumers that they would be coming. We put up signs for that. And then this is our early childhood manager, who is talking about the process. All right, so a little bit more on the two major initiatives that we had at the same time. So again, we have the evidence-based practice of feedback-informed treatment that I'm going to talk about, but now going to talk about the cultural change that we decided to undertake, and that was Trust Edge. And again, I'm not preaching Trust Edge as the be-all, end-all, but what we did was hired an organization to come and certify some trainers at our organization. And the reason that we chose Trust Edge and the reason that we went with these guys was that they offered a consistent message of how to improve your work relationships and also how to improve your personal relationships. So really, the training that we provided was always about trust being the single greatest factor in a person staying at an organization and the single greatest factor in a person leaving an organization. I'm sure that for you, if you have left a job under not the greatest circumstances, trust probably had something to do with that. And we were very intentional to say that, our past engagement surveys really had determined that people felt a lot of trust in their team, right? They felt really purposeful about the way that, about the work that they're doing, but and really trusted their team and often their manager. But then once you started to go broader, right, up to, is the leadership team making the right decisions? Is the organization making the right decisions? That trust started to really fall off. And we were very intentional, again, about saying this is an issue that we have at our organization, and we are going to work to change this. So Trust Edge, you can see they all happen to be C's, pillars of trust. But we trained our leadership team, so that was a full two-day training. And then we started the process. We trained all of our managers, and then started the process of training every single one of our staff. And so it is a full two-day training that they go through. And so every 2 weeks for a year, we worked on getting everybody that training. And now every new employee that comes in, every 2 months, then we offer another training. And that just in itself is pretty powerful. We bring a lot of people from a lot of different programs together, ask them to be vulnerable and share about their experiences. But I think our staff really feel that wow, an organization that is willing to take me off the floor, for lack of a better term, for 2 days because they're invested in me and they're invested in our culture, I think has been pretty big for us. Did a lot of different initiatives, trauma-informed care as a part of that, a part of our accreditation journey. This was just one example of something that we do, trauma-informed care heroes, where people can get nominated. We have these signs all over the place, and then they get recognized in our newsletter. And so just briefly to talk about feedback-informed treatment, this is, and I can definitely talk with you more about it, but a method of having consumers say how they're doing before a session starts, and we track that on a graph, and see how you're doing in the therapeutic relationship at the end of a session, and we track that on a graph. And again, we made the decision that we wanted at least 70% of our entire consumer base to get at least one of these interventions every single month. We're starting now to build these into dashboards. But when you do a change like that, what we're able to show are some pretty awesome statistics. So people who are getting fit on average have that much lower. Is it 69? I can't see that. Yes, 69% lower no-show rates. They are more likely to have improved on their CCAR outcome measures. And they actually engage in treatment more often, which is not the inverse of no-shows. They actually show up more often for their treatment services. And so being able to demonstrate this, not just to our staff that, yes, this is something you want to do, but also our payer sources is also a big deal for us. So in sum, again, CARF or not CARF, I think pursuing accreditation really is demonstrating a commitment to excellence for your organization that hopefully can stand the test of time and really can demonstrate to those that we serve and also those in our community that we have that commitment. Thank you.